So, chapter 10 is actually going to be a pretty fast chapter. This one is about quality assurance in the dental office. The learning objectives for this chapter are going to be to define the key terms associated with quality assurance in the dental office. We're going to list quality control tests and quality administration procedures that should be included in the quality assurance plan. We're going to discuss the purpose and frequency of testing dental x ray machines. We'll discuss the tests used to check for fresh film and adequate screen film contact. We're going to discuss the frequency of testing and the interpretation of test results. We will describe the tests used to check for darkroom light leaks and proper safe lighting. We're going to discuss the frequency of testing and the interpretation of test results. We'll discuss the tests used to check the automatic processor, discuss the frequency of testing and interpretation of test results, and we'll list the 3 tests used to describe the strength of the developer solution. We will describe the preparation of the reference radiograph and the standard stepwedge radiograph. We will discuss the use of these radiographs to compare densities and to monitor the strength of the developer solution. And we'll describe the tests used to check the strength of the fixer, discuss the frequency of testing and the interpretation of test results, and we will discuss the quality control tests needed for digital imaging procedures. We will discuss the basic elements of a quality administration program, and we'll detail the importance of operator competence in dental radiograph procedures. Okay, so quality assurance refers to special procedures that are used to ensure the production of high quality diagnostic images. And the purpose of this chapter is going to be to introduce to the dental radiographer to quality control tests that are used to monitor dental x-ray equipment, supplies, and film. So we do have certain tests that we use in order to check to make sure that our machine is working properly, that our film is working properly, that our processing solutions are the correct temperature and consistency and things like that. And although the dentist is ultimately responsible for making sure that all of these things are done, the tasks themselves, as usual, fall to all of the dental radiographers, so the hygienists and the assistants. Okay, so there are specific tests used to maintain and to monitor the dental x-ray equipment, the supplies that we use, the film processing systems that we use, and the digital imaging equipment that we use. In order to avoid excessive exposure to our patients and to the personnel to x-radiation, the dental radiographer has to have a clear understanding of the quality control procedures that we use to test these x-ray units, the supplies, the film processing, and the digital imaging equipment in the dental office. Okay, and so the equipment that we need to test is going to be the dental x-ray machines. We need to test the dental x-ray film. We need to test the screens and cassettes, and we need to test the viewing equipment that we use in order to look at our radiographs. So all dental x-ray machines have to be inspected and they have to be monitored periodically. They have to be calibrated at regular intervals. And then the American Academy of Oral and Maxillofacial Radiology recommends a number of annual tests for dental x-ray machines. Typically, a representative will come, some type of service person will come and check the machine and give the dentist some type of reading. There are local and state regulatory agencies that provide some of those inspection services. It's always at a cost. And then the dentist, the dental hygienist, dental assistants, or the manufacturer service representative can perform those annual tests. It's not just that service representative. Right, and every time we open up a new box of dental x-ray film, we need to make sure that that film is fresh, right? We need to make sure that it's still good, it's not expired. And so what we will do, one, you'll check the expiration date, obviously, but then you'll also take one of the films out from the box. You're going to go ahead and run it just like you would as if it were an exposed film. You'll run it through whatever your processing system is, either the automatic processor or the manual processing. And if it comes out clear but with like a slight blue tint, that means it is a good film. If it comes out kind of foggy, then that means it's either expired, it's been stored improperly, or it was somehow exposed to radiation. Maybe you have a light leak in your dark room. And so we know that if the film comes out clear and good, then it's good and safe to use on our patients. But if it comes out fogged, then it isn't good, and we need to figure out either the box itself of film is bad, or maybe somehow our processing systems are bad. Each box needs to be checked for freshness before it is used on our patients, okay? It has to be checked before. And you remember with our panoramic x-rays, we use those intensifying screens and we place those screens inside cassettes. And so here we need to be checking that our extraoral intensifying screens are not dirty and they're not scratched. We should be cleaning these monthly. And then our cassette holders, we need to be checking for, maybe the clasp isn't working, so it's not getting a tight seal. If there's any type of light leaks or if there's any type of warping, if you had a hard cassette and it's warping, that would be a bad thing. But if you had a flexible cassette, obviously it would warp a little bit. A commercial cleaner is usually available in order to clean these cassettes and the screens. You don't want to use just any kind of cleaner whatsoever. Use the one that the manufacturer recommends. And then also, once it's clean, you want to spray it with an anti-static solution so that you won't get that static electricity across any of your radiographs. Okay, and so then we will also have a test we can run on our screens and cassettes to make sure that they are nice and tight up against the film. And so what you do is you insert the film in the cassette holder, you place a wire mesh object on top of the loaded cassette. You then point your PID with a 40-inch target to film distance. So basically you're pretty far away from the cassette at the time. You expose the film with 10 MA, 70 kVp, and 15 impulses, and then you process the exposed film. You process it just like you would normally in a light safe area, and then you would view the screen. I'm sorry, you'd view the film after it's done. If you get a nice sharp image like the one on the right, then you have an adequate contact. If you get a blurry image, sort of looks like a plaid pattern there on the left right there, that is going to be an inadequate contact. And so, if you're getting the one on the left here, then you know that you need to replace um, the cassette, and then if you're getting the one on the right that your cassette and your screens are an adequate contact with the film. Okay, so the view box is the light source that we use to view dental radiographs. And so we place our radiographs on this light box. It's also referred to as an illuminator or a view box. And it's made out of plexiglass usually, and then there's like light bulbs right behind it. If the view box needs to be wiped down daily to make sure that there's no dirt or debris. You wouldn't want to accidentally have some dirt on your view box and then you put your film over it and then the dentist thinks the patient has a cavity, right? That would be pretty horrible. And so you're going to want to make sure that it's clean every time you're using it. You want to make sure that the light is all uniform behind it. You're not having any one area that's dim or dark. And then you also want to make sure that the plexiglass itself isn't scratched or that the bulbs aren't too dim in order to read those radiographs. All right, so then film processing, we're going to be talking about the darkroom lighting, we'll talk about processing equipment, and we'll talk about processing solutions. These are the most critical areas in quality control, and these are the ones where the most mistakes happen. Okay, so your dark room should be checked for light tightness every month. So every once a month, you go in, you shut the door, you turn off the lights, and you turn off the safe light as well. And you're going to make sure that you don't see any white light entering the room around doors or around vents, or you wouldn't have a window, but you check any and all seams in the room. Every 6 months, you're going to want to perform a safe lighting test. And so you would prepare the dark room and you would examine the dark room just to make sure that it is light tight. If every month you perform that test and there are no light leaks, then you can go ahead with your film processing just like normal. If you do have a light leak, you're going to want to either use weather stripping or black tape of some kind in order to seal up that light. All right, and so every 6 months you're going to want to do a coin test to ensure that your safe light is working properly and that you're not going to be damaging your films with it. So what you'll do is you would go in, make sure your dark room is prepared. You would turn off the white light. You would turn on your I'm sorry. So first you would put the coin on an unwrapped, unexposed film. Basically, you would just go in, you would open the film, set the film down on the table. You would put a coin on top of the safe light, or I'm sorry, on top of the film. You would turn on your safe light for 3 to 4 minutes, and then you would remove the coin, and then you would process the film. You can see here that picture on the right. That is a picture where you can clearly see the outline of the coin. That is not safe not a safe light. That is a safe light that is causing damage to your radiographs. And so you would need to either replace your safe light or somehow, correct the issue here. If you were to get an image that was completely clear, then that would be a proper safe light. You wouldn't be able to see the coin shape on your radiograph. Oh yeah, and so here it says it. So proper safe lighting, you wouldn't see a visible image on the process radiograph at all. If it was improper safe lighting, you'll see that outline of the coin and you'll see a fogged background appear on the process radiograph. Okay, and so then to process or to check your processing equipment, your automatic processor test film, what you're going to do is you are going um, to take two films. You're going to process one film that was not exposed to light. You're going to open another film, expose it to white light, and then you're going to run both of them in your automatic processor. So here you'll know that your automatic processor is functioning properly. If the one film that was not exposed to light comes out completely clear and dry, and the exposed film, the one that you exposed to the white light, that one comes out completely black but also dry. If either of if your processor isn't working properly, then the unexposed film doesn't appear clean and dry, and then if the exposed film does not appear completely black and dry, then your processor isn't functioning. You'd have to figure out where the problem is. All right, and the next area that can go wrong is processing solutions. So the first things we can do is the developer strength. We can use three separate tests for this. We can use a reference radiograph, a stepwedge radiograph, or a normalizing device in order to check the developer strength. These processing solutions, obviously, they get replenished daily, but they should be getting completely changed out every 3 to 4 weeks, which is what we talked about in chapter 9. Okay, so the first test is a reference radiograph. It's when you go through and you pick out a radiograph that you've taken in the past that is like the perfect radiograph. It has the right amount of density. It has to be processed with the same machine, obviously, but we want to make sure that it's a wonderful radiograph. It looks exactly like it should as far as contrast and density and things like that. Then you would compare films that you have every day. At any point in the day, you pick out a film and you compare it to that perfect radiograph that you have. And you would see if every radiograph you took that day was lighter than the radiograph, the perfect one, then you know that your developer solution is probably too weak or it's too cold. Or if all of your radiographs that day are darker than your perfect radiograph, your reference radiograph, then you know that your developer solution is maybe a little too strong. Oh, and this slide says everything I just said. So if the density seen on the reference radiograph match the daily radiographs, then the solution is adequate. If it doesn't match, then it means either your developer solution is either too weak, it means it's old, it needs to be replenished, or it's too cold. And that would be if your radiographs are lighter than they should be. If your radiographs are darker than the reference radiograph, then either your solution is too concentrated or it's too warm, or you're leaving them in there too long. So we can also use stepwedge radiographs. In this one, we create a stepwedge in this class. It just depends on when you're viewing this, because I know some of us have makeup labs. So if you have done the week 2 lab, then you have made a stepwedge. If you haven't done the week 2 lab, then you haven't made one yet. But we're going to create these, and we're just looking at it based on contrast and density. But we can also use our stepwedge in order to determine the developer solution. And so what you would do is you would use 20 films to create a supply for daily testing. You would expose the film, process one of the exposed films with fresh chemicals. You would store the remaining exposed 19 films. You would process one of the exposed stepwedge films every day. I know that sounds crazy, but you do that because every day you want to make sure that your solutions are at the right temperature and that they're at the right intensity. And so if you do them all at one time, obviously you're going to get all at the same intensity. So every day you want to take the new radiographs. So each day, if those densities match, then the developer solution is adequate. If they don't match, you can see here between A and B, see how B, the middle the middle portion here is lighter. You can see that the solution in B was either weaker or it was colder than the solution was when it was in A. And so we would have to determine, which one is the one you want and then go from there. So you can actually also use a normalizing device. It's just a monitor that you buy. It's commercially available. Fixer strength. When the fixer solution loses strength, the film takes a longer time to clear or becomes transparent in exposed areas. And so a fixer should actually be able to clear a film within 2 minutes without shaking it around. And so the way to test this is to take a film, open it, don't put it in the developer. You just put it straight into the fixer and it should become completely clear within 2 minutes. It looks like my slideshow has jumped the gun. So for the clearing test, you would prepare the film and then you would check the film for clearing. So then, like we said, that film clearing, if the film clears in 2 minutes, then the fixer is adequate strength. If it takes longer than 2 minutes, like if it's not completely clear within 3 to 4 minutes, then the fixer solution needs to be replaced. So then we also have quality assurance protocols for offices that use digital imaging, and that's also a requirement. They have to perform backup of digital data on the computer on a daily basis in order to save those radiographs so that they don't get lost. They have to perform annual tests for calibration of imaging equipment, and then there are commercial kits that are available for cycle efficiency. Okay, so the management of the quality assurance plan, that's basically all the office is really required to have is that they need to have a plan. The plan needs to include the description of the plan. It needs to figure out who's assigned which duties, a monitoring schedule, a maintenance schedule, a record keeping log, the plan for evaluation and revision, and in-service training. The copy of the quality administration plan should be made available to all staff members. Each staff member needs to be able to participate in the quality assurance program, and periodic in-service training for all staff members is also recommended as a part of quality administration procedures. All right, so like we said before, the dentist is the one who's ultimately responsible for all of the dental images that are exposed in his or her office. A non diagnostic film has to be retaken, right? And so any retakes are going to expose our patient to additional radiation, and we need to reduce the amount of retakes that we are doing on our patients. And so continuing education courses and individualized instruction can be used to upgrade and improve the competency of the dental radiographer. So even years from now you may be a wonderful dental hygienist, but maybe you are terrible at opening contacts, and so you're having to constantly retake your patient's bite wing x-rays. And so there's nothing wrong with going back and getting a refresher, a continuing education course, years after you've already become a dental radiographer, you've been taking x-rays for years. There's nothing wrong with going back and learning more in order to better serve your patients. Don't forget that you're always going to be learning. You never get to stop learning because the standard of care is always going, the bar is always going to be raised. So just like always, if you have questions, please put them in that question and answer discussion board. You can always send me an email, or you can ask me in person too when I see you in lab.